Hello, Dr. Montgomery.
Hello, Steve. How are you doing?
Good. Nice to see you again.
Likewise. Good to hear your voice and good to talk to you.
Good. So it's going to be just you tonight. Dr.
Okay.
Allen moved his panel to another night. So this will give us an opportunity to ask you some questions directly.
Wonderful. Look forward to it.
Okay. Do you want to first take a minute just to quickly give people an idea of what you've been doing the last 20 years?
Wow. So as many of you may know, I'm a board certified cardiologist. I've been practicing in the allopathic medical space for a long time. My medical practice, which consists of internal medicine, cardiology, and cardiac electrophysiology, which covers all the specialties I was trained in, has been operational for going on 26 years now. In the context of that operation, I started out, seeing patients in the acute setting, in the outpatient setting, implanting devices, doing, cardiac catheterization procedures, peripheral arteriograms, and doing cardiac ablations and device implants like defibrillators and the like. My medical approach to things began to evolve over time as I saw my patients getting sicker. Started seeing how chronic illness affected my life personally as well as family members. So we started with a plant-based nutritional approach and saw great outcomes, excellent outcomes in our patients in a very short period of time. We created more support systems and a great structure around using plant-based nutrition as an intervention in and of itself. We went to the extent of putting a restaurant, nutrition center, grocery store in our medical facility. Excuse me. More recently, we've started integrating other modalities. We started using targeted nutraceuticals, other regenerative therapies such as ozone therapy, infrared sauna therapy. We're looking at integrating things like stem cell therapy and the like. So we use a combination of lifestyle and natural interventions to help patients with advanced chronic illnesses reverse these illnesses and also reduce their requirement for prescription medications, medical procedures, and hospitalization. We manage the patient who are acutely ill in the hospital, so we will manage them there, stabilize them, detox them in that setting, remove them from the hospital setting, manage them in a quasi or subacute setting in our center, and stabilize them to where they're, living a more healthy and an optimized life. We also have trainers, so we use prescribed exercise. So fitness is a formal part of our integrative and regenerative therapeutic approach.
Okay. And do you still work in a hospital?
Yes, so I still work in a hospital. I have admitting privileges at one of the largest hospitals in Houston. I practice in the world's largest medical center, our medical center is 4 miles south of that center. So we practice a different type of medicine, but I still have to admit patients to that hospital to stabilize their condition. The other day, I was called by one of our patients who had her mother-in-law was ill in the hospital, and she asked us to help out in that regard. I spoke to the physicians. This patient was in the ICU, and we're sort of helping manage her care to a certain extent, using some natural interventions juxtaposed with the allopathic approach to try to, improve her overall health.
So, Dr. Montgomery, you are in a very, very unique situation. You're a medical doctor, a cardiologist. You work in a real mainstream hospital doing mainstream heart and cardiac work. And then you also have your own center that uses whole food, plant-based nutrition to treat people. So
that's correct.
So you're not offering us a theory. You're saying you're one of the very few people in the country that is fully immersed in two different worlds. So it's where many people are just offering a thought or an opinion or something they read. You are in the thick of it in both worlds. So what do you want to tell us? Are we overvaluing the benefits of whole food plant-based? Are we undervaluing it? Like, what is the difference between, tell us the difference between the two, what the results have been, what the approach is, like, how would you compare these two different approaches to taking care of your heart?
That's a very excellent question. And it's interesting. And as I'm listening to you finish the question, I'm thinking about, well, what's the best answer? So you ask, are we overvaluing it? Or are we undervaluing it? And interestingly enough, the answer may be a little bit of both. And by that, I mean the following. We clearly undervalue it. And I think maybe if I have to give a percentage response, maybe 75% is undervaluing it. Okay, maybe it does a 25% overvalue it. And maybe it's 80-20 or whatever. But the point is that we clearly undervalue the power of nutrition in the sense, and that's not the whole food plant-based community that's undervaluing it, but that's just us in the medical community in general. The reason I say this is that we see patients who have severe illnesses. When I say severe illnesses, they are so acutely ill, they're too sick to have bypass surgery. They're too sick to have acute angioplasty, or too sick for any other kind of surgery. And some of them are often given up for hospice. And we've had many of those patients who put on a defined, I like to use the word defined, plant-based nutritional regimen with certain manipulations of the food. And those patients can get a complete turnaround in their overall well-being, to the point where they come off medications, are discharged from the hospital, removed from hospice care, or become ambulatory, and are able to exercise to a certain extent. So that's what we have seen, not just one or two patients, but with thousands of patients over 2 decades, from time to time, at different levels of illness in terms of how well they turn around. So that's the power of nutrition. The small percentage in which we may overvalue it is in the sense that there are many individuals who may have severe deficiencies, be they a severe micronutrient deficiency or mineral deficiency. Maybe they're severely deficient in magnesium, or whatever the case may be. You may have to then use some target supplementation to assist the body in healing itself. Maybe someone that has severe cancer, well, we may need to use a target micronutrient supplementation, for example, intravenous vitamin C, or intravenous ozone therapy, or infrared sauna therapy, et cetera. So there are many individuals who have certain specialized conditions who would benefit from some of these added approaches that are necessary to help turn them around. So I would say it's a little bit of both. Certainly the power of nutrition is not valued enough, and that's the majority of that response. But there's a small aspect that we don't realize, those of us who are in the plant-based community don't realize, that it's not always enough, and other adjunctive therapies need to be added.
Do people who eat a whole food plant-based diet with no oil and minimal salt, sugar, and fat, do they still sometimes have heart attacks and strokes?
They can. Now, let me quantify that, because then if you have those individuals who may have severe deficiencies, because again, things that predispose us to heart attack and stroke are not just, as I like to call it, dead animal flesh foods, although that's a big contributing factor. And they may not always be just some of the toxins and the processed carbohydrates that people may eat. So if someone is on a whole food plant-based diet, let's say, for instance, they converted to a whole food plant-based diet within the last year, but maybe they're 51 years old, but the 50 years prior to that, they were eating perhaps the worst standard American diet there is. So then they're on this whole food plant-based, low salt, low fat diet, but maybe they're microwaving their food, and maybe they're cooking most of their food, et cetera. they haven't, with that diet, have not given the body a chance to go back and correct these, processes and abnormal processes that's built up in their system.